So we are going to start our class now. Today, this will be the second class. In this class, we'll be discussing about the different type of letter, which include your referral, which include your discharge letter. So we are going to discuss types of letter with reference to the nursing care, and we have very less likely than when you have the you can say letter of referral with letter of referral actually. So let's start with a category. Normally in OET nursing, we have a letter of referral, with a diagnosis. Normally it's basically worsening of conditions, such as case 1, we have a patient who has hypertension and he presented with uncontrolled hypertension. Normally we have a diagnosis being mentioned and the patient is here with uncontrolled hypertension, right? And secondly, you can see there all of the people, we have a case with diagnosis, right? With a diagnosis, when we have a case that is being diagnosed with hypertension and he presented to you with uncontrolled, let's say, blood pressure, and we have assessment diagnosis elevated blood pressure or maybe orthostatic hypertension. So we are writing this letter to the family GP. If you being a ward nurse or a community nurse and now you are writing this letter to a family GP for the full cardiac assessment, so maybe the past history would be irrelevant, right? Similarly, we have a case, you can just write it down in this way. I'm writing regarding your patient, Mr. James Smith, a known case of hypertension who has uncontrolled blood pressure for the last 1 month for full cardiac assessment, right? We have a case 2, let's say hypertension, diabetes, depression. We have 3 things ongoing. So we can just write it down. Last episode of hospital admission on this date for pericarditis, home visit. There is a, we can say, reoccurrence of this episode, though we can write it down to the emergency doctor on duty, requesting urgent assessment and management of pericarditis, right? So you can see there, we can just write it down in this way. I'm writing, thank you for seeing Andrew, who is suspected to have reoccurrence episode of pericarditis, right? So in this regard, you can just write down the introduction clearly, right? Okay. In this regard, you can write it down, the introduction clearly. Is it clear to you? So as you can see there, we have this case, let's say, we have these 2 cases when we have a patient who is being referred, actually for the elevated blood pressure and for the relapse of pericarditis, right? So we have this patient, let's say, when we can write it down for the sake of, for example, for the sake of referral, right? So these are few examples for referral letter in a patient who's having. Okay. So we can see a letter without a diagnosis. Again, similar is the case. You can see there, we are writing this letter without a diagnosis. Okay, we have a case, then we are writing this letter without a diagnosis. Then you can just see there is a patient who is having hypertension. There's a patient who is having hyperthyroidism, right? There's a patient who is having, let's say, blah blah problem. So complaining of indigestion, for example, is here with a complaint of indigestion, first of all, right? And basically, we have this patient, for example, who is distressed, pale, and complaining of persistent chest pain. So in this regard, you can see that this patient is being referred to the emergency department. And we need to see that you have to write it down in this regard. If you have a patient, you can write it down in this regard. I'm writing to refer Mr. XYZ, let's say the name of the patient. I'm writing to refer Mr. XYZ, who presented to my clinic, who's suffering from, who presented today with severe chest pain. Therefore, she has been transferred in our hospital with ambulance, right? So we can see there, this is the format of writing. You can write it down in this format, as you can see there, right? Anyhow, so these are the general format of writing the referral letter without a diagnosis. Okay, right? Anyhow, then you can see another example of without a diagnosis. We do have a patient who's something ongoing in her condition, right? It's a letter that we're writing without a diagnosis, a situation that has to be explained, a situation that has to be explained. Refer to a school psychologist to find out whether Allison has underlying grief or what, right? So we can just write it down, that thing as it is over here, right? Okay. So basically, if you can see there, we have a patient who has no diagnosis, just have the symptom. So we can write it down, this thing as it is over here, right? Is it clear to you? Okay. So we can just sign out to refer Mr. Allison, for example. Okay. So basically, we have a patient, you can write down, I'm ready to refer Allison, who need to be evaluated if he is having underlying grief or any other psychological problem, right? So we can see that in this way, we can just write it down, the main concern where you have a referral letter that is uncommon for nurses in that way, right? Is it clear to you? Fine. So as a matter of fact, you can see that we have discussed about the basically, like type of referral letter in regard to the diagnosis. We have discussed about the type of referral letter when we do have the diagnosis being given, right? When we do have the diagnosis being given, this is a type of referral letter, right? As we have discussed something over here with you. Okay. So then we have the next category, that is a letter of discharge. In a conventional letter of discharge, either it's medicine for nursing, but we are discussing nursing over here. If relevant or as per sequence, we can write down social plus past medical history. But mostly in a conventional letter of discharge, if we have a ward stay, if we have the rehabilitation, let's say, if we have the, you can say, discharge plan, so we need to summarize the ward stay. We have to expand, let's say, the rehabilitation, and the discharge plan should be expanded again. Is it clear to you? Anyhow, so we have a letter of discharge in the conventional category. We are writing this letter of discharge as a ward nurse to a community nurse. So with a ward stay or maybe the hospital admission details, both of the things will be provided, can be written over here. We have the rehabilitation details, right? Okay, and the discharge plan or maybe nursing care can be written over here in this way. So we have to summarize these details. The introduction can be written. I'm writing this letter of discharge regarding Mr. James, who has undergone a successful right knee replacement surgery and is being discharged today into a care for further follow-up, right? This can be written in that way. Is it clear to you? Okay. So afterward, we can see there a letter of discharge, conventional follow-up, let's say, we have this information being given. Let's say degree of mobility, surgical repair, whatever, nursing care, mobility, slow onset of large ulcer, hygiene maximum. So we have discharge plan. So you are a charge nurse on the hospital ward where Mr. XYZ has resided during his hospital stay. Using information in the case note, write a letter of referral to the community nurse supervisor at the community nursing center who will be attending Mr. Watson following his discharge. So though it's written a letter of referral, but it's basically a letter of discharge, right? It's basically a letter of discharge. Anyhow. So moving on to the next type of letter. We are writing this letter to the occupational therapist. We are writing this letter to the physiotherapist. We are writing this letter to the, let's say, like a social worker. Then we can see that letter to the eligibility care for the pension care can be written over here. And letter for genetic review, right? Say these are different type of request letter, right? Can be done in this way. Okay. Is it clear to you? Okay. So you can see in this category referral discharge can be written over here. So I'm writing to request you regarding Mr. James' workplace assessment as he has been recovering after a successful writing replacement and want to resume his job. This can be in the category of referral letter, right? Then we can see a letter of discharge in unconventional. Request letter to the nursing assistants post-discharge. In this letter of discharge, request to nursing assistants post-discharge, let's say patient conceived triplets by IVF, patient will need daily wound dressing, whatever. We have certain things. You can see that, first of all, it's a unconventional letter of discharge. We are writing this letter. First, you have to see, you are writing this letter to the nursing coordinator, explaining that he will need full assistance with babies. So, again, a nurse coordinator has to arrange someone who will be looking after this lady and her children. So we can write it down in this way, right? We can write down in this way. Is it clear to you? Anyhow, so as a matter of fact, as you can see there, you can see there, we have, let's say, for further assistance, we can just write on, I'm writing regarding Mr. XYZ, let's say, I'm writing regarding Mr. XYZ, who has conceived triplet via C-section. She would require a full-time assistant for her babies and also for her 5-year-old son. Okay. Is it clear to you? Right? Okay. So then we can see another type of letter of discharge. Let's say we have basically a letter of discharge. You can see we have, let's say, a post-discharge to a social worker. There was a patient who is having surgery of cabbage, right? Who is having surgery for cabbage. And you can see there, we have the following option, let's say, in this regard. And as a matter of fact, as you can see there, we have the following option being given. So we have to write a social worker. So what is the role of social worker first? You have to understand that. What would be the role of social worker? As you can see there, the role of social worker would be to help the patient to start his normal life. The transition back to normal life, right? Transition back to the normal life. This is the role of social worker, that he has to make sure that the patient would start his normal life, right? This is the role of social worker. So according to this situation, you have to make sure that you must write it down, those things that would be relevant and appropriate for a social worker. There might be a lot of detail being written. There might be a lot of detail being written about the patient, but you have to keep in mind that I would like to add something that is related to the person, right? That is related to the person. Okay. So the here we can write it down that, okay, we can just write down, I'm writing to request your social services for Mr. Nasir in order to help him resume his normal life since he has been discharged after a successful cabbage surgery, right? So we can just write it down in this way. Okay. So we can see this is the letter of discharge when we are writing to a social worker. So the focus will be on the social services that is being the part of the or the job of the social worker. Okay. Then we can see here letter of transfer to the hospice care. Hospice care is a one-way transfer when there is no coming back. Okay. Letter of transfer to the hospice care is one-way transfer when there is no coming back, right? So in this regard, when there is a one-way transfer, there is no coming back, what we can do is we have to focus on the palliative care, the main task, right? We have to focus on the palliative care, that is the main task, right? Anyhow. So basically, if you can see there, uh, according to the situation, the most important thing is that he must be pain free. He's very weak and disoriented. He's not able to tolerate solids. So these are the main details that we should put focus on. So we can just write down, as you can see, it has been advised by the social worker. So I can just write it down in this way. Social worker contacted brother, advice place in. So as per the social worker advice, we are writing this letter. So we can write it down in this way. I'm writing on the advice of social worker regarding Mrs. XYZ, a terminally ill patient who has been under our care for the treatment of cancer. Hence, she would require a place in your hospice care. So, accordingly, we are writing this letter to the director of nursing, and we are requesting director of nursing to provide a place. Right? To the social worker. Is it clear to you? So, accordingly, we can go by that. Okay. So then we can see there will be a next letter. Letter to the basically letter of request, again a transfer for a dietary advice. You can see there is the guideline. First of all, diagnosis obstructive coronary artery, operation coronary artery bypass graft that has been done, which is not related to the dietary advice. Routine post-operative recovery is being doing. Hospice care is the place where the patient will be shifted during his last day. If there is a terminally ill patient, he will be shifted to the hospice care for the last day care, right? In case if you have a terminally ill patient, that's why we have this transfer to the hospice care, right? Now we have a request. Let's say that is your letter of request. Letter of request. We are writing for the dietary advice, right? For the dietary advice, actually. So basically, if you can see there, we have obstructive artery, and there is a patient who is having this problem. The routine post-op recovery, low-fat diet, walking well, wounds healing well, routine visit from social worker, discharge plan, returning home to this and this place. So basically, now we are writing this letter to request advice on low-fat dietary guideline and health simple recipes. we are writing this letter to the community information section of Heart Foundation, right, on the patient behalf. So basically, on the patient behalf, we are writing. You can see that you can write in this way. I'm writing with regard to Mr. XYZ, a 53-year-old man who has requested advice on low-fat dietary guidelines and healthy, simple recipes after his discharge, since he has undergone a successful artery bypass graft. If you have written this introduction in that way, I'm writing this letter regarding Mr. XYZ, who has a successful artery bypass graft, and therefore he required. It will not be an appropriate thing to be done. It will not be an appropriate thing to be done. First, we have a clear focus. That why it should be written and why it has to be arranged, right? Okay, why it has to be arranged. Okay. Fine. So you can see there, these are different format of writing, different type of letter that we are discussing with you for your better understanding, right? For your better understanding. Is it clear to you? Anyhow, then we can see another type of letter of referral. You can see we have a letter of referral or request or discharge, but it will be in the request category to the aged care patient. Aged care assessment mean there will be a nurse who has to, there will be a nurse who has to basically, like, who has to assess the patient requirement if the patient will be shifted to the home care for the home assessment. So we can just write down in this way. You are a nurse, let's say, for example, who with the Blue Sky Home Nursing, you visited the patient at home today for the first time following her referral from this condition. Right? So we can see that we have to write it down in this way. Diagnosis melanoma of left shoulder removed successfully. So discharge, provided there are no complication with the wound healing. Your role in providing nurse care ends with sutures are removed on this. You're considered that Ronnie need to be assessed for further ongoing assistance in managing the house and garden, and the shopping assessed for further ongoing assistance. Request a home visit by this thing. Okay. Okay. So you can see that we can just write down. I'm writing to request aged care assistance for Mr. XYZ, an 83-year-old man who is recovering from a malignant melanoma in his left shoulder. So basically, we are writing for the aged care assessment to assess the patient requirement, what would be required back at home. And accordingly, we will see and we will write it down accordingly, right? Right? Is it clear to you? Okay. Then we can see we are writing this letter of request to the pension care, the old pension age care. We are writing this request, right? So according to the situation, we have to write it down, this thing. Let's say I'm writing to for there will be a patient who might need some basically assessment, who might need your help financially. For that reason, it would be appropriate to help the patient out in the financial ground. So when we read this patient who has left inguinal hernia, he was having his own home, large garden, which they maintain without any assistance, financial assistance. They were very independent. I am proud that they have never applied for a pension or home assistance. They have also they have also basically have managed their home quite well on their income from a number of investment. Concern now loss of investment, concern about the garden, and they depends on the taxi now for commute. Let's say patient wife is becoming increasingly deaf. It's difficult for her to talk on the phone. They are eligible for pension as per them. So we are discharging the patient with this discharge plan. we are discharging the patient with discharge plan, right? So we can just see that apart from this thing, right now, this is the purpose for the Department of Veteran Affairs. We are writing this letter to, and they have to assess the patient if they are eligible for pension or not. So we can just write down, I'm writing request, I'm writing to request a home visit by Department of Veteran Affairs staff to Mr. Jim XYZ and his wife to assess their eligibility for our Department of Veteran Affairs. We write in full form. I just have written short form or other assistance that your department could provide. So you can see we are writing this letter for that regard, right? Anyhow, so request for pension care. Can be written for request for pension care, right? Then we can see these are the transfer letter in different category that involve transport. That, for example, from low to high setting, from side to mainstream, from ward to emergency department, from same specialty to same specialty referral, or maybe there are some categories such as transfer to hospice care, transfer to nursing home, and transfer to GP, from old GP to new GP. These are some of the referral letter that has to be written, right? So you can see there, we can see in the transfer letter, mostly the transport is being involved. And the main thing, for example, if you are transferring the patient from nursing home to a nursing home, it's also a letter of transfer. Okay. It's also a letter of transfer. We can see there, we have to see. Now we can see over here, I'm transferring this letter of transfer, for example, to your patient to hospice care, who is a terminally aged patient, terminally ill patient, right? Is it clear to you? Anyhow, so we can see, according to the situation, we have to write it down. Normally, transfer a letter, we write it down for the hospice care, for the uh, department change, right? We can write it down, the transfer letter for these things. Okay. Anyhow, so these are some of the things that you have to have in order to understand the transfer letter, right? Okay, for the hospice care and so on. Is it clear to you? Okay, then we can see there, we have to write it down in this way. Then we have a letter of education. It's less likely that being a nurse, you will get a letter of education because it's mostly common in the pharmacy. But still, you have to see if you're writing this letter to the, we can say, to the parents or to the community, we can have letter of education or information, right? So these are